Joining us this morning on the Morning Blend is Dr. David Nebbeling, who is a board-certified regenerative medicine specialist. Doctor, good to see you.
Yeah, it's good to see you too, Bob.
So you've been on the show many times talking about regenerative medicine. So tell us about the training that's involved with that sort of field.
Regenerative medicine is the non-surgical approach to rebuilding and repairing damaged joints. The American Osteopathic Association's College of Prolotherapy and Regenerative Medicine is the most well-established college that has been training physicians as well as advancing this field of medicine since 1938. And actually, just over this past week, we had our national conference out in Phoenix, where I had the unique opportunity of helping to train physicians from all across the country who were interested in learning how to do the sort of things that we do here. Aside from the conferences and the training, the college also oversees board certification in the specialty of regenerative medicine.
So tell me about board certification.
Yeah, so there's definitely some doctors who will attain a little extra training like I talked about and be able to offer, say, prolotherapy or PRP in their office. But oftentimes their board certification as well as their primary focus, it actually lies elsewhere, which is okay. But to be board certified through our college has rather stringent criteria and extensive requirements, such as minimum of 3 years of experience actually doing these types of procedures on a regular basis, passing intensive written and oral boards, and then most importantly, actually having to perform these procedures on real patients in front of an examination committee. And this is in order to ensure that, number one, a physician can safely do these procedures, but also to ensure that board certified physicians are truly proficient and skilled in their field of practice.
You're board certified, obviously. Where else can patients find board-certified regenerative medicine specialists?
Yeah, exactly. So me and my father, who started this practice here in Lansing well over 2 decades ago, are boarded in our specialty. But unfortunately, there aren't a whole lot of physicians that offer these types of treatments, and there's even fewer that are board certified, like we talked about. And that's not to say that they don't do great medicine, because a lot of them do. But to put this in perspective, there's actually less than 30 physicians in the entire nation that hold board certification. And at our office, we have the only 2 in the state of Michigan. So obviously we're a little biased, but I do believe that high quality board certification is important to any specialty of medicine, and definitely something that patients should be thinking about when they're looking into getting prolotherapy, PRP, or biologic therapies.
Well, good information, Doctor. Thank you so much for joining us again.